I'm Dr. Ryan Flannagan. I'm a gastroenterologist at the Brigham and Women's Hospital. And today I'm going to be speaking about anemia, which is basically low blood cell counts. And we'll talk about what that is, what to do if you're found to have anemia, and then talk through what to talk to your doctor about. So we'll start with what is anemia and why does it matter? What are the causes of anemia? And then what symptoms should alarm you? And when and how should you talk to your healthcare provider if you're found to have anemia? So we'll start with a patient case. Elizabeth is a 60-year-old teacher who's been feeling tired and short of breath on her daily walks. Her doctor orders blood tests and finds anemia, which means a low red blood cell count. So Elizabeth wants to know, what does this mean for her? What questions should she ask, and what should she do next? And so we'll talk through each one of those questions. But first, what is a red blood cell? So it's one type of cell in the blood, along with white blood cells, which make up your immune system, and platelets, which help with clotting of blood. Red blood cells carry oxygen in your blood to the rest of your entire body and help it function. And so without enough of these red blood cells, your body can't get the oxygen it needs to feel good. And anemia means your blood doesn't have enough of these healthy red blood cells circulating around to bring oxygen to all your important organs and your entire body. And so this condition, anemia, is very common in the US, affects millions of people every year. And it often can be a sign of something serious, so needs to be taken seriously and further worked up if you're found to have anemia. This is often found on a complete blood count, which is abbreviated with CBC. And there's two values that we look at on that, the hemoglobin and the hematocrit, abbreviated by HGB and HCT. So you should be able to see those on your lab results. It's a very common test, the complete blood count that we get. And either one of those, or usually both of those, will be low in the setting of having low red blood cells. And that's a sign to us that there's something going on where you're not either making enough, you're losing them, or you're having them destroyed in some way where you're not actually able to maintain a healthy level of red blood cells. So there are a ton of causes of anemia, and we won't talk through all of them today, but there are a few common buckets of anemia where conditions can present similarly. So you can have low production of red blood cells. That often happens if you have a diet that ends up being low in certain vitamins and minerals, or if you're just not able to absorb those vitamins and minerals, the most common ones being iron, vitamin B12, and folate. Or you have a problem with the production factory of the body, the bone marrow, so you can't actually produce the red blood cells that your body needs, and that's really just due to a problem with the bone marrow. The second type is destruction of red blood cells. This can occur again for a variety of reasons, but the most common one is some sort of autoimmune condition where your body ends up destroying the red blood cells in the bloodstream, and then you end up not having enough because of that. And then the last one, which is the one we'll focus the most on today, is blood loss. And so this can often be microscopic blood loss, meaning you don't see it, but it's happening slowly over time. And because of that loss of red blood cells, you end up having a low red blood cell count over time. And that a couple examples of that can be bleeding from the stomach or the colon in your GI tract, and losing that in your stool, but you may not realize it because it's very, very small amounts of blood often. And so again, this is anemia that's due to slow blood loss that you really can't see. And a couple examples like that I mentioned, in the stomach, you could have stomach ulcers or sort of irritation of the stomach lining that leads to bleeding over time. You can have issues in the small bowel or large bowel, known as the colon. That could be things like polyps or abnormal growths in the colon, or even a colon cancer or a stomach cancer. Sometimes the only sign of anemia is having this low red blood cell count. You may not always have symptoms. We'll talk through some of the symptoms you might notice, but it's important, even if you feel totally normal, that if you're found to have anemia, that this gets worked up further by your healthcare provider to determine what the cause is. So back to our patient, Elizabeth, she has additional labs sent by her primary care provider. One of those tests checks her iron stores, and she's found to have a low iron level. And this is known as iron deficiency anemia, meaning Elizabeth doesn't have enough iron in her body to make new red blood cells and have enough to circulate the body. And iron ends up being really important because it serves a key role in the hemoglobin molecule within the red blood cells to carry oxygen around the body. And so if you don't have these building blocks of iron, then you can't make enough red blood cells and you end up making smaller red blood cells that are not as efficient in carrying oxygen around the body. And so this is one of the most common types of anemia, especially one of the most common types that we see in gastroenterology. It's due to insufficient iron in the body, as I mentioned. And that can be two main reasons. One of them, which I just mentioned, is loss of iron through blood loss. But you can also have issues with decreased absorption of iron. Iron is absorbed in the small intestine. And if your small intestine is inflamed or you have other issues with your small intestine, you may not actually absorb the iron that you need to make these red blood cells. This type of anemia, iron deficiency anemia, often requires a camera test of the stomach and the colon, known as an upper endoscopy, or EGD for short, or a colonoscopy. And these sorts of camera tests look for any inflammation or abnormalities that may be contributing to iron deficiency anemia. And so back to our patient, Elizabeth, she has those tests showing low iron. So she's sent for these camera tests, the upper endoscopy and the colonoscopy. During the colonoscopy, a growth is found that ends up turning out to be colon cancer. However, it's an early catch. So because this anemia was taken seriously and she had this camera test early, her cancer was found before it has spread. And that makes a big difference in terms of how treatable it is. And often early colon cancers are very treatable. And so this really is an example of why it's so important to take anemia seriously and to get a further workup to figure out what's happening. Now, I mentioned sometimes patients don't always have symptoms of anemia, but these are some of the things that you might experience if you have a low blood cell count. You could have tiredness or weakness, generalized sort of fatigue. And that's obviously a common symptom. And so this would be outside the usual for you. So there's been some change where you're even more tired than usual. Shortness of breath, especially as you're sort of walking around or exerting yourself. If you don't have enough red blood cells, your body is trying to keep up and get the oxygen it needs, but you may just not be able to. And therefore, you'll feel short of breath when you're walking around. You may also feel dizzy for a similar reason. Your brain's not getting quite as much oxygen as it needs. And then tachycardia means fast heart rate. And so that can be feeling like palpitations or sort of a racing heartbeat. And that is due to your heart trying to keep up. Without enough red blood cells, it's pumping faster and harder to try to get that oxygen to the rest of the body. But oftentimes it can't quite keep up, and you feel that sort of racing in your chest. So really, any of these new symptoms, if these occur, especially in the context of having a low red blood cell count, are reasons to see a healthcare provider and ask about the cause. If you have a low red blood cell count found on a blood test, especially if you don't know why, that's really an alarm bell. And one of the most important things is to figure out what the cause is. Um, like I said, mention any new tiredness, shortness of breath, pale skin. Also, if you're having any blood in the bowel movement, so I said it could be microscopic, you can't see it, but sometimes you can see red blood, a change in color to black stool, or even just very, very dark stool. Those are reasons to also talk to your healthcare provider and make sure that you've had a complete blood count sent. And then any sort of unexplained weight loss or loss of appetite should be further investigated as well. Things you should ask a healthcare provider are, what is causing my anemia? Above all else, that's probably the most important question. You don't want to have a low red blood cell count without a known reason, because almost in every case, there is some underlying reason that should be investigated further and figured out to figure out what next steps you need, whether it's further diagnostic testing or treatment. Do I need more tests? So endoscopy and colonoscopy are going to be common ones that we're doing for this issue. There may also be additional tests that you want to make sure are being thought of by your healthcare provider. Is there anything at home that I can do to help? So like I mentioned, if it's due to not taking in enough iron or vitamin B12 or things like this, then you may be able to increase those in your diet or take a supplement to help with the blood cell counts and increase them. And then will this get better on its own, or do I need treatment? So really, this is important because if your red blood cells gets too low, then it becomes a much more serious issue where you may need to get a blood transfusion. You may need to get an iron infusion if you have low iron. And so there are lots of times when the anemia is severe that you actually need some treatment to improve it, and it may not get better on its own. And then lastly, should I see a specialist? So once some of this initial workup is done, especially if you need something like an endoscopy or colonoscopy, you're going to need to see a gastroenterologist like myself. Or if it's more of an issue with the bone marrow, for instance, or directly with the red blood cells, then you might need to see a hematologist or a blood doctor to get more further workup from them. And so, a few tips when you're discussing this with your provider: bring a list of your current symptoms. That's really important for us to know exactly what you're feeling and experiencing. You want to note any changes to your bowel movements, appetite, or energy level. You want to track when you first noted the symptoms and if they progressed in any way. And then bring any outside records or prior lab tests. Sometimes we're seeing this anemia, the low red blood cell count, for the first time on your labs, but we don't know, was this present a month ago, a year ago, 10 years ago? And that's very relevant to why you might be experiencing this. And so if you have had prior tests at another facility, bring those in when you're getting checked out. And then ask about the next steps in diagnosis and treatment so you know what you're going to be experiencing. But there are lots of tests that can be done for anemia. And so you want to take it one step at a time and just do sort of the test that your doctor is mentioning up front. And then as long as you've come up with a cause of the anemia, you often don't need a lot of further testing after that. So it's easy to get lost in the testing. But again, just focus on one step at a time. And so some key takeaway messages: anemia is a really common disease, but it has lots of different causes. And so those need to be investigated. You may not feel anything until your blood cell counts are very low, for instance, needing a blood transfusion. Always ask your provider about the cause of anemia. Again, that's the number one most important thing, that you want to get to the bottom of it when you have this. And then don't ignore any new tiredness that's outside your usual, and any bowel habit changes, particularly changes in color of your stool to red or black. And then early workup and diagnosis of anemia can save lives, like our patient, Elizabeth. Thank you very much for your attention, and thank you for the invitation to speak today.